The complete blood count. Total RBC count. PCV. Plasma protein concentration. Total WBC count. Blood film evaluation, differential WBC count, RBC and WBC morphological evaluation, platelet estimation. Reticulocyte count. HB concentration. Erythrocyte indices, they're back. RBC count. Should be in the millions. Usually done by machine. Can be done manually with UNIPET and hemocytometer. Is outdated and difficult to obtain diluents. PCV. Packed cell volume. Indicates the percent of packed red cells in a patient's blood. Done with hematocrit tube that has been centrifuged. Takes very little time and can be quick diagnostic tool. Normal ranges. Plasma protein concentration. Utilize the already centrifuged PCV tube. Read using a refractometer. Helps to determine abnormal amount of protein in blood. Protein present may be from fat or other sources. Normal ranges. Total WBC count. Usually done by machine. Can be done manually with UNIPET and hemocytometer method. Again, outdated and difficult to obtain diluents. Critical in determining absolute number of WBCs. This is the number with diagnostic value. Blood film analysis. Used to calculate the relative WBC percentage. Used to evaluate RBC and WBC morphologies. Used to perform reticulocyte count if patient is anemic. Used to perform platelet estimation. Review retic. And platelet calculation. I am not going to reteach these. Calculating the absolute WBC count. You must have done a relative percentage from a blood film. Written as a percent. You must have a total WBC count. You will then take each relative percentage and multiply each by the total WBC count from your CBC analyzed blood. Calculating the absolute WBC values. Your relative percentages were as follows. Neutrophils, 52%. Lymphocytes, 38%. Monocytes, 7%. Eosinophils, 3%. Basophils, 0%. Take each cell's percentage and multiply by the total WBC numbers from the machine readout. Let's say that your total was 38,000. Your WBC total was 38,000. 38,000 x 52% equals 19,760 total neutrophils. 38,000 x 38% equals 14,440 total lymphocytes. 38,000 x 7% equals 2,660 total monocytes. 38,000 x 3% equals 1,140 total eosinophils. 38,000 x 0% equals 0 total basophils. The percent is very important in your calculation. Simply hit the percent key after you punch in the number you are multiplying the total by. Notice that your numbers add up to 38,000. Hemoglobin concentration. Usually done by machine. Different machines use different techniques to estimate HB concentration. Lysing solutions. Photometrics are only as accurate as machine is. Calibration is important. Erythrocyte indices. MCV, average volume within RBC. MCHC, average HB concentration within RBC. MCHA, average weight of HB within RBC. Review these calculations, please. Performing the CBC and clinical chemistry tests on the IDEX machines. Blood must be drawn in both lithium heparin, microtube and large purple top tube. These are tubes designed for the IDEX machines. You can use a serum separator tube in place of the lithium heparin tube. Remember, do not remove the stopper from the large purple top tube. Do not fill tube past bottom of label, 0.5 to 1.5 cubic centimeters. You will need to remove the top from the micro tube. IDEX CBC and chemistry. Centrifuge the microtube or serum separator tube for ~7 minutes. Transfer plasma or serum off and place in serum cup. Barbie shot glass. Place purple top tube and gray top tube obtained from Ms. Kenner in CBC machine. Barcodes on purple and gray tubes must match in order for your tests to be valid. If purple tubes do not have a barcode, this is okay, as long as they're the large tubes. IDEX machines. To run the chemistry portion of the test, you will obtain test slides from Ms. Kenner. On the monitor of the vet lab station, use the stylet to enter the following information. Click Analyze Sample. Enter Client, VTI. Enter peer name, patient ID hash is fine. Select Next and then select Reason, Routine SXE Wellness. At the bottom of the screen, you will need to tap the test icons desired. CBC and Chemistry, and then stop running your tests. If you haven't already loaded the large purple top and gray top tubes into the CBC machine, do so now. Then hit Run. Look at the LED screen on the body of the vet test machine. Follow prompts on the LED screen. This is where you will add the slides one at a time. Do not open the foil until you are ready to load the slide into the machine. Do not touch the center of the slides. You will need to handle the slides by the edges and make sure the barcode is UP. Running your tests. Once you have placed all the slides in the machine, follow the prompts on the LED screen. Place pipette tip securely on the pipetter of machine. Press Eve on LED keyboard to continue the analysis. Lower pipette into plasma and press button. Machine will beep 1 time. Release button. 2 beeps, remove pipette. 3 beeps, wipe pipette tip and replace in machine within 20 seconds. You will hear 1 more beep after pipette is replaced. Test is running. The machine will automatically pipette the appropriate amount of plasma on each slide to run the tests. Total run time is ~6 minutes. When test is complete, press E. Remove pipette tip, empty used slide drawer. Machine should start printing results. If not, press E and wait. If results are still not printing, try selecting option 2, Print Results. Printers. The internal printer on the IDEX machine is disabled on our machine. We have an external printer connected to print results. Paper must be loaded before you start running tests.